I was pretty stunned. And I think those words, "it's cancerous" or "you have cancer," do stop you in your tracks.
Former NBC Today Show anchor Katie Couric revealed recently that she was diagnosed with breast cancer in June. It was found after she missed her annual mammogram. It's a reminder for all of us to stay up to date on those screenings. And here to tell us more about the importance of mammograms this Breast Cancer Awareness Month is Dr. Jill Westerkamp from Iowa Radiology. Thanks so much for being here with us this morning.
You're welcome. Thank you for having me.
Well, let's just dive right in. First off, how do people assess their risk for breast cancer?
So women, there's a lot of risk factors that go into if you're going to develop breast cancer. One of those is your weight when you started having children, how many children you have, your periods, family history, of course, and your breast tissue density is one of those risk factors as well, which I know Katie Couric spoke about. Breast tissue density, I don't know if people understand really what that is, but breast tissue density is not something you feel. Breast tissue density is how a breast tissue looks on a mammogram to a radiologist. So what a lot of people don't understand, there's 4 different levels of breast tissue density. So some breast tissue is very fatty, and that's 10% of the population. Some breast tissue is extremely dense, and that's 10%. But then most of us live in the middle, 40% of scattered areas and scattered dense patches. So when you have dense tissue, you're kind of lumped together, but not all dense tissue is the same.
So will a mammogram pick that up? What does screening and detection look like there?
A mammogram will tell you what your level of density is, and the more dense the tissue, it sometimes can hide smaller breast cancers. So there is increased risk with dense tissue, but there's a lot of different risks. And your density does change over time, and it does change based, over with weight or hormones and age. Different things can change your density. So women shouldn't get locked into, I'm always extremely dense and I will always be extremely dense, because that's not the case.
So why those yearly screenings are so important?
Every year. It's very important every year to get your mammogram. And starting at age 40, I know there's a lot of confusion out there in the press, and you were talking about colon cancer earlier, and there seems to be some confusion with that too. But 45 for colon, but 40 for mammograms. And it's been like that for 30 years because we're decreasing the death rate from breast cancer. So it's really important for everyone to start at 40. Unless you're high risk, then you start earlier.
Yeah, I was going to say, for women who aren't yet 40, what do they do in the meantime?
So what we need to do is really be concerned about risk assessment and finding out what our risk is, because different women have different risks. And there's risk assessment tools. When you come to Iowa Radiology, we give you that number. If you're over 20, we do recommend mammograms beginning at age 30, as well as MRIs, and alternating those two and starting younger. But also there's other women like non-white women. So Afro-American women have a higher risk of having genetic mutations and more aggressive cancer. So they should really get this risk number by the time they're 30 to see if they should start screening earlier. Asian women peak earlier, and Hispanic women peak earlier than white women. So we really need to get that out there, but 40 minimum, please get the mammograms.
Sure, and really quickly, what's kind of the takeaway here? It's as easy as a phone call?
It's as easy as a phone call. You can get it online, you can schedule your mammogram, you can call us up. You don't need an order. You can do that yourself. So please, take charge of your life and get that done.
Sure. Well, Dr. Westerkamp, thank you so much for the insight into this very important topic. We appreciate it. We'll be right back after this.